What is bipolar disorder? Bipolar disorder is a mood disorder characterized by recurrent episodes of elevated mood termed as mania with or without episodes of depression. So, what happens in mania? In mania, basically, we see that the individual is in a state of excessive happiness more than normal. Okay? There is a state of increased energy levels, there is increased activity levels that we usually see both in terms of physical activity and mental activity. There is a state of grandeur, a state of well-being, a lot of risk-taking behaviors like maybe reckless driving. You see a lot of excessive spending, maybe in some cases increased sexual energy, and often they feel a decreased need for sleep. So they could also have episodes of depression in between, which has some core symptoms like, of course, low mood, loss of interest in pleasurable activities, and a state of mental or physical tiredness, which they often express. So with a lot of low self-esteem and low confidence. Now let's talk about the common types of bipolar disorder. The common types of bipolar disorder are bipolar disorder type 1, bipolar disorder type 2, and cyclothymia. In bipolar disorder type 1, it consists of episodes of mania and depression. In bipolar type 2, there are episodes of hypomania and depression. In cyclothymia, there are episodes of symptoms suggestive of depression and symptoms suggestive of hypomania, but the severity of symptoms in both the cases are not as extreme as seen in type 1 and type 2. So, is bipolar disorder curable? No, bipolar disorder is definitely not curable, but it's a disorder which can be managed well, treatable, and controllable illness. The patient can be brought back to a state of pre-morbid functioning levels. So, the treatment options that we offer for a person with bipolar affective disorder is, of course, the mainstay of treatment consists of medications. Apart from that, based on the severity of the symptoms, maybe options like ECT can be offered. Apart from that, if the severity of symptoms is still higher, the patient can be hospitalized and rehabilitated to ensure that the functioning returns to pre-morbid state. Okay. So, in terms of psychotherapy, which is also the continuation of treatment, the options offered are, of course, psychosocial interventions like cognitive behavior therapy, IPSRT, that stands for interpersonal and social rhythm therapy, and of course family focused therapy. So at Catabems, we definitely have a wide variety of treatment options, and we definitely give a personalized treatment care based on the severity of the patient's symptoms, and we ensure that the symptoms of the patient are taken care of as well as the caretaker needs are also taken care at the Catabems Center. So what causes bipolar disorder? The causes of bipolar disorder can be classified into genetic, environmental, and psychological. Of course, the most common cause being genetic. What you have seen as per studies is that as per family studies, the possibility of a family member having a bipolar disorder is more than 70%. And if at all there is a parent who is diagnosed with bipolar disorder, the probability of the son or the daughter developing is about 25%. And if both parents have it, then the probability increases to 50%. The other causes of bipolar disorder can be, of course, the environmental causes like drug abuse. Drug abuse can induce a state of bipolar disorder as well as trigger bipolar disorder in a patient who is vulnerable to develop bipolar. The psychological causes of bipolar disorder, of course, is the stress that occur because of maybe some examples like maybe a loss or a death in the family, maybe a lot of financial loss, physical complaints or physical illnesses, physical or mental abuse, and so on. What are the symptoms of bipolar affective disorder? So let's start off with what is bipolar affective disorder. Bipolar affective disorder consists of recurrent episodes of mania and depression. So the symptoms of depression, of course, is a persisting low mood, loss of interest in earlier pleasurable activities, a low self-esteem, a low confidence, low energy levels, a feeling of guilt or a feeling of burden to the family members, death wishes, decreased concentration, and of course decreased appetite and decreased sleep. So what is the difference between depression and bipolar affective disorder? So when you're talking about difference, I'll be more specific here. We are talking about difference between unipolar depression and bipolar disorder, which consists of bipolar depression and mania. So in state of depression, the symptoms are definitely similar. The triggers for these episodes also can be very similar. But what happens in a bipolar disorder is, along with depression, there are episodes of mania that occur, whereas there is a state of elevated mood, increased energy, and a state of increased physical activity. And these episodes are interspersed between the depressive episodes. But in unipolar depression, these occur as independent episodes which resolve, and then they can again get back another episode, leading on to recurrent depressive disorder.